This is Elaine Oyang. I'm a certified yoga therapist. And today I am here with Dr. Stephanie Wu. She's a licensed acupuncturist. She has a practice based in San Francisco. And we actually, both of us actually went to the same school in Taiwan growing up, even though we didn't know each other that well. But now that we're both in the health and wellness industry, we reconnected. And I asked her to come on to have a conversation with me about the crisis that we are currently in with COVID-19 and how, from the Chinese medicine standpoint, what are some of the suggestions and lifestyle guidelines of boosting the immune system and keeping yourself healthy. And she'll talk about a little bit about acupuncture as well, but now with social distancing in effect, now's not the time to hurry to your closest acupuncturist, but just hear about and learn about how acupuncture in the future, after this crisis has kind of calmed down, that you can use acupuncture to help boost your immune system, as well as manage any respiratory problems that you may have in case of future crises like this. So without further ado, this is Dr. Stephanie Wu. And do you want to give yourself a little introduction as well?
I mean, you basically got it all. My name's Stephanie, and I have a practice here in San Francisco. And I'm here to share whatever I have, whatever knowledge I have to share for immune boosting tips, to explaining what acupuncture is, whatever you guys have in mind, just go forth and ask.
Okay, awesome. Well, I think first of all, we can start with what is acupuncture, and maybe it's some roots of it from the Chinese medicine system. I know that some people are still not familiar with it or are curious but maybe afraid to try it. So you can give some more description of it and what it is to help people make that decision for themselves.
Okay, well, that's a great question, because one of the most common questions that I always get is, what exactly is acupuncture, and how does it work? And the way that I like to explain it is like in a way where you don't have to have taken a Chinese language and culture course to really understand it. I'm going to try to explain it in a way that kind of makes sense to anyone who has taken any sort of like middle school biology, regardless of their cultural background. So the way I usually explain how acupuncture works is, John Mayer likes to say that your body is a wonderland. It has evolved to adapt to all sorts of conditions, trauma, illnesses, disease, as we are evolving now, actually, with all this, with the coronavirus situation. But of course, the wonderland has to have a system that helps it operate. And that is where blood and the circulation of blood comes into play. So acupuncture, overall, in Chinese medicine, it's all about circulation, because blood is what brings nutrition and oxygen to each and every cell in your living body. And it is what supplies life to life, basically. So in Chinese medicine, we place a huge stress on good circulation, because we believe that at the end of the day, if you have good circulation, then that means your body is optimizing its internal resources to its max, and that will help you stay healthy. Poor circulation is when disease and pain happen, because you have poor blood flow to the tissues and the cells, and no nourishment to those cells that eventually lead to either cell mutation or cell death. So that's kind of my take on it. Poor circulation means you don't use your body's internal resources as optimally, because even though you have those resources, they're not getting to the places that need it. And I guess the core of Chinese medicine is all based on circulation. and really using what your body has to supply and just really helping your body optimize what it has.
I really like that explanation of the circulation and using John Mayer's song.
Okay, fine. That was because I was listening to a song by him, in the background, and I was like,
it is a wonderland. And it's like, I always tell my clients too that your body is so capable of healing. It's just that we get in our own ways of healing. And what you do definitely is kind of, it sounds like it's redirecting and optimizing how your body is using the resources, because we all innately have that. We just don't know how to tap into it. And this sounds like, with the importance of circulation and this focus on circulation in traditional Chinese medicine, it's also really great for anyone with chronic pain and maybe fatigue, which is like a lot of the times that I work with in my clients. So it sounds like this is also a great resource for them as well. So my next question is, and I'm sure you get this a lot, is that, so what are the needles doing during acupuncture section?
First of all, these needles are extremely thin. They say you could put like 20 of these acupuncture needles into one like normal hypodermic needle for like your flu shot or whatever, which you should get. And they're sterile, one-time use only. So I always get people asking like, oh, so what do you do with the needles after? We have to send them in, we have to put them in like, a sharps container, send them to special facilities that actually basically incinerate them. But getting back to what the needle actually does is that basically the needle just serves as a tool. Over thousands of years, Chinese people have basically mapped out different acupuncture points along the body that correspond to different organs. So for example, like a point on your leg on the stomach channel, you can use that to really help circulation get to the stomach digestive area. So what these needles, we use these needles as tools to help stimulate these points that will bring circulation to those specific organs or the areas or the pathway that the Chinese have mapped out to basically help redirect circulation into areas that need more circulation. So that's in essence what the needles do. We can get into like all sorts of different topics within that, but that's the general idea. We're not putting anything in your body, apart from the actual needle, but we're not injecting you with anything. Yeah.
Just the skin. Yeah. So, and speaking from personal experience, like most of the time the needles, they don't feel like anything at all.
No,
not really. And sometimes it feels like a little pinch. I tend to get really sensitive in my feet, and you can let me know what channel that is, but I tend to get really
there's a bunch.
I know there's a bunch. That's really cool in terms of like boosting the circulation. And it's cool that even if you're working on your stomach, like there's all these channels, energy channels that are all over your body and can work, like you said, somewhere in your leg or foot, and that will affect your stomach channel in different ways. So I think that's really cool. But in, again, not encouraging anyone to go book an acupuncture session right now. Now is the time for social distancing, but for in the future, in terms of boosting immune system or boosting the lungs, is this something that acupuncture can also help with?
Yeah, for sure. So a lot of times I explain that Chinese medicine is one of the medicines that really understand that there's a deficiency component in terms of the body. Western medicine does a great job for like quelling stuff that like fever and stuff like that really quick. But in terms of like day-to-day feeling tired and deficient, and also just lack of energy, and like certain things like chronic allergies, chronic pain, that falls more into what we call deficiency, where we have to help your body. The way that we help people with who feel this, who are more deficient, kind of run down, is that we help them basically find ways to help themselves boost their body's internal resources by stimulating the production of it naturally. Either if it's through like through acupuncture and herbs. Usually that's the best combo for that sort of deficiency syndrome. But in general, we really want the way that Chinese medicine really helps to deal with these chronic like immune system problems, fatigue, chronic pain, is that we really try to help your body rebuild these resources. And yeah.
So it sounds like acupuncture is great for anything that's chronically going on or as a preventative measure.
Yeah.
Awesome. Well, I noticed that you mentioned herbs, and I know that you personally also use herbs in your practice, and I was wondering if there are any, I don't know, commonly accessible herbs that you can buy at the store in this time to help you boost your immune system or your respiratory functions, if you have any suggestions, or any lifestyle or dietary guidelines at this time that people can do for themselves to help stay healthy, to keep their respiratory system healthy, and to keep their immune system optimal.
Yeah, in Chinese medicine, we have a saying where we really link good immune function to a strong overall body, but specifically to good digestion. Because in Chinese medicine, your digestive function is the center of everything. You know, if you have weak digestion, that means over time you have a decreased ability to break down food into nutrients that your body can use. And that kind of leads to less nutrients being absorbed. And then with less nutrients being absorbed, your body is not able to make as much of that natural internal resource, such as white blood cell, red blood cells, immune kind of cells that help with immunity. So a weakened, that causes basically your whole body to become more susceptible to certain triggers, and overall leads to a weakened immune system because your entire body is weaker because you don't have that internal resource. That goes back to the whole deficiency thing that we were talking about earlier. So definitely during this time, it's really crucial to take good care of your digestive system. And some tips that I usually give patients is in terms of digestive system, definitely make sure during this time you eat really well. You know, eat a warm, balanced diet. I know it's kind of hard to get some of these things right now because of the grocery stores, but you know, you do your best. Definitely recommend a lot of nice warm soups, even though, especially here in the Bay Area, where the weather is still pretty cold. You can do stuff like ginger tea. All these things, warming things, help increase circulation, and especially to the gut area, which is what we want. And then, of course, when you're eating, you could definitely try to eat peacefully. Don't be working while you're eating, and because that kind of turns on. When you're working and eating, you're not focusing on the digestion part, and that takes away circulation to your digestive system as well. So when you're eating, just be mindful of just only eating. What else do I usually tell patients that are easy, free, and simple?
Any foods or herbs that are great for the lungs, for example?
So definitely recommend ginger tea, especially if you're feeling a little cold. That's always like, that's super easy to get, and you can make it yourself. You can add some honey to it. Other foods that are good, if you have kind of like lung dryness, or you just you're feeling a little dry, kind of dry throat, we definitely recommend a simple Asian recipe that can go kind of as dessert, steamed Asian pear with honey. And it's so basically you core the pear, and then you pour a little bit of honey in there, and then you steam it, and then you eat that. You eat everything.
That sounds yummy.
So that's good. Yeah, that's really good. I actually just had it yesterday. It's really good for lubricating, keeping your lungs moist, and keeping you hydrated as well. So that's another huge thing. Obviously, keep hydrated. Other suggestions, with the wind being pretty crazy around here and the rain, our Asian grandmas would always say, keep the back of your neck warm. And because in Chinese medicine, that's where we say, if you expose your neck, the back of your neck specifically, to wind and cold, that's how you really compromise your immune system. Because that area is really sensitive to any sort of temperature change. A lot of very important, like your vagus nerves, all these like things that keep your body, help your body maintain homeostasis, its constant condition. A lot of these things, systems are here around the neck area. So it's more susceptible to any sort of temperature change. So definitely keep that warm. We say that will help you prevent colds, and you don't want a cold right now because that will dip your immune system and make you more susceptible to viruses and stuff like that. And another huge thing is dry your hair after you wash your hair. Sounds like a really stupid small thing, but it can make a world of difference. When your hair is wet, I remember grandma used to always like scold you. But that makes you more susceptible to getting a head cold, which will also dip your immune system and possibly make you more susceptible to getting all sorts of other things too. So right now, definitely, stay warm, stay dry, take care of your digestive system, sleep a lot if you can. Try to sleep before 11 p.m. is what we say, because that's when your liver and your gallbladder organs really help your body detox. Let's see, what else? Use this time wisely, this is, how do you make this type of crazy time into something that's productive, and a time where you can really work on things that you usually don't get time to work on, such as spending time with your family, or writing that blog that you wanted to write, or whatever it is that,
or sleep more.
Always wanted. Yeah, or sleep more.
I've definitely felt like the need to sleep more the past week or so, just because of the craziness of it all. And I guess I'm like slightly stressed by it too. And I just felt like the need to sleep more and sleep in when I can. And yeah, I really, especially a lot of people I know are working from home. They probably have more flexibility to do that too, and just kind of get in that rest when they can.
But yeah, and definitely don't stop moving either. I think that's the thing that's driving most people crazy. Like, go out for a walk. Just, don't do that in a huge group setting.
Wear your scarf and your hat when you go out.
Yes, wear your scarf, wear your hat. Take some yoga classes with you, and just basically use this time to really restore yourself,
Mm-hmm. For sure.
Yeah. Oh, I forgot. Another great food that you could do at home is simple congee. Yeah.
So for people who don't know what congee is, can you explain what that is, and also how to make it?
Sure. It's basically rice porridge. It's very cheap, and it's really great for your digestive system. When in Asian culture, when people are sick, it's like the equivalent to like a warm chicken soup. We feed people congee when their digestive system is really weak, because Congee, yeah, it's you put rice. Well, I have a rice cooker, so I guess
So the
for those who
measurement a little
don't,
different.
you add, yeah, just go online and search for congee. But
Yeah,
yeah, it's
basically
basically
the
rice
ratio of
porridge,
water.
and you can add a lot more than your regular like steamed rice,
Yeah,
like
the
double
ratio of water and
ratio.
rice is like way more. Yeah.
Yeah. And you can make it fun too. You can add all sorts of different condiments to add to it. I like to add seaweed, and there's some interesting Asian varieties. You can add like ground meat, all sorts of things. You can get creative with that. So
Mm-hmm.
that's definitely another thing that I would recommend, especially now that, all the grocery stores are emptied out. I hope you have rice.
I think
'Cause I
at
do.
least yesterday when I went to, or 2 days ago when I went to Safeway, like all the pasta shelves are cleaned out, canned beans are cleaned out, but there's still bags and bags of rice, like the big ones. I'm like, I'm grabbing one of those. So,
Oh yeah, I
it's
grabbed
one of
one
the
like
few
2 weeks
things
ago.
that are left. So if you don't have rice yet, stock up on it, make some congee. That could be a great sustenance and food, and also great for digestion. It's warming, and you can, like Dr. Steph said, like, you can get creative with it too.
Totally. Yeah.
Awesome.
So
Well,
yeah.
thanks for sharing all of your knowledge. And the more I listen to, of course, I kind of grew up in that culture, having grown up in Taiwan, but now that I'm more diving in the studies of yoga and Ayurveda, which is kind of like the equivalent of the Indian traditional medicine. And there's definitely a lot of similarities and correlations, such as eat warm foods, optimize your digestion, keep your body warm, exercise, but not intense exercise, like moderate and appropriate amount of exercise according to like your body constitution, body type. And there's an equivalent of the Indian congee as well, and Indian rice porridge as well. So it's very interesting to see
Awesome.
similarities of these.
For sure. Yeah, and I'm definitely working on a lot of resources. Really hoping to post some of that up soon now that we all have a lot of time
Yeah.
to
So where can
better
people find
explain
you?
all this.
So where can people
Well,
find you?
you guys can find me at my site right now, but I'm working on opening another resource soon. So for now, it's stephaniewuacupuncture.com.
And the
Very
Stephanie
creative.
is with an IE, right? Oh, so
Correct. Yeah.
STEPHANIEW acupuncture.com. Yeah, so I think it's good time that we wrap this up. Thank you again, Dr. Steph, for coming on. And again, not that we're encouraging you book your acupuncture sessions now, but just some information and guidelines for your lifestyle and dietary habits to help you boost your immune system and stay healthy, stay well during this time. And once this passes, as it all will, maybe you can consider a time to either book a session with Dr. Stephanie, or if you're not local to San Francisco, wherever you are, look up your local acupuncturist to help you with chronic symptoms that Dr. Stephanie mentioned, like chronic pain, feeling fatigue, or maybe you've had chronic allergies, or just feeling generally kind of unwell, but not really enough to have like a clinical diagnosis. I think acupuncture really is good for that too, if you're just feeling like not right, but not really that sick. And that's something that with the acupuncture sessions can help with circulation and getting your body thriving again. Cool. So you're frozen again, but we can leave it at this. Thank you, everyone. If you have any further questions.
Well, thank you so much.
Oh, there it is. Yeah, thank you. If you have questions, feel free to email myself. I am at elaineyogatherapy@gmail.com. And Dr. Steph is at info@stephaniewooacupuncture.com. And I can also link these to all of you. Otherwise, have a great day and be safe, be well. Hope you utilize some of these tips and guidelines today and the next few weeks to help you keep healthy. Okay. Froze again, but bye.